If you've been checking your blood sugar every morning and wondering why the number won't come down even though you're taking your medication, even though you've cut back on sweets, even though you're doing everything your doctor told you to do, then what I'm about to show you in the next 20 minutes is going to reframe everything you think you know about diabetes and food. I'm Dr. Michael Reed. I've spent 25 years in internal medicine specializing in metabolic health. And for most of that career, I watched my type 2 diabetic patients follow every protocol in the book and still see their A1C creep up year after year. More medication, higher doses, bigger problems. I had to ask myself a hard question. Is the system failing these patients, or are we missing something fundamental about what's actually driving their glucose in the wrong direction? The answer was both, and today I'm going to show you what I found. We're going to cover 7 specific foods, and some of them are going to surprise you because they're sitting in your kitchen right now disguised as reasonable choices. We're going to go deep into the biology of why your body after 55 responds to these foods completely differently than it did 30 years ago. And we're going to talk about what the research actually shows, not the guidelines written a decade ago, but the peer-reviewed science published in the last 5 years. By the end of this video, you will understand your blood sugar better than most patients who've had diabetes for 20 years. If what I share here today helps you or someone you love who's been fighting this condition, please subscribe. It costs you nothing. And it tells the algorithm to show this to more people who need to hear it, but will never find it in a 15-minute doctor's appointment. Let me start by telling you something that took me years to fully accept as a physician. The standard medical approach to type 2 diabetes is almost entirely focused on managing the number on your lab report. Get the A1C below 7. Adjust the medication if it climbs. Repeat every 6 months. What that approach almost never addresses is the underlying reason the number is climbing in the first place. And the reason matters enormously, especially after 55. Here's the core problem. In a healthy body, when you eat carbohydrates, the pancreas releases insulin. Insulin acts like a key that unlocks your cells, primarily your muscle cells, so glucose can flow from the bloodstream inside those cells where it gets burned as energy. Blood sugar stays stable. The system works. But in a body with type 2 diabetes or insulin resistance, the locks on those cells have become corroded. The key still works, technically. Your pancreas is still producing insulin, but the lock won't turn properly. Glucose piles up outside the cell. It stays in the bloodstream. Your fasting glucose is high. Your A1C climbs. And your doctor increases the dose of the key. More insulin or medication that forces the pancreas to make more, without ever asking why the locks corroded in the first place. The locks corrode for very specific biological reasons. And 7 categories of food are the primary accelerant. Now here's what makes this more urgent if you're over 55. A study published in Frontiers in Endocrinology in 2024 confirmed something we've known in research circles for years. As we age, muscle mass declines. In adults between 40 and 80 years old, skeletal muscle, the body's single largest consumer of glucose, drops by 30 to 50%. Lean muscle tissue is responsible for absorbing roughly 80% of the glucose in your bloodstream after you eat. Think about that. Your muscle is the main engine that clears your blood sugar, and after 55, that engine is running at 60% of what it used to be. Same amount of glucose coming in from food, dramatically less muscle to absorb it. The result is a blood sugar spike that's higher, lasts longer, and does more damage to every blood vessel in your body. And this doesn't happen evenly. When you eat the 7 foods I'm about to describe, you're not just spiking your blood sugar in the short term, you are actively accelerating the breakdown of that muscle, deepening the resistance in those cellular locks, and adding fuel to a low-grade inflammatory fire that burns continuously through your joints, your arteries, and your pancreatic cells. You may not feel it today, but your A1C knows it happened. Ask yourself honestly, when did your doctor last explain to you why your blood sugar is high? Not what medication to take, not what number to aim for, but the actual cellular reason your glucose stays elevated even when you're trying. If that conversation has never happened, you're not alone. Most of my patients came to me after years of managing a number without ever understanding the mechanism. That ends today. Let's talk about the first food group, and I promise you this one is going to sting a little. White bread, white rice, regular pasta, refined flour products in all their forms. I know this isn't news, you've heard to cut carbs, but what most people, including most doctors, have not explained is the specific damage these foods do at a cellular level that goes far beyond a temporary blood sugar spike. A systematic review published in the Journal of Nutrition in 2022 analyzed 22 randomized controlled trials covering adults with and without type 2 diabetes. The researchers found that replacing refined bread products with high-fiber alternatives produced a measurable reduction in fasting blood glucose. Not a food diary estimate, a measured, clinically confirmed reduction. And that's the critical word, fasting. We're talking about your morning number, the one that reflects what your body was doing all night, not what you just ate. Which means refined grains aren't just spiking your blood sugar at lunch. They're disrupting your metabolic baseline for hours afterward. Here's why. Refined grains have been stripped of everything that slows their digestion. When you eat white bread, you might as well be eating glucose directly. Your small intestine absorbs it within 30 minutes. Your blood sugar spikes fast and hard. Your pancreas panics and pumps out insulin. And then, if those cellular locks are already corroded from years of insulin resistance, most of that glucose can't get where it needs to go. It stays in circulation. It eventually gets stored as fat around the liver and the abdominal wall. And that abdominal fat, visceral fat, the dangerous kind that wraps around your organs, becomes its own inflammation factory. It releases chemicals called cytokines directly into your bloodstream that make insulin resistance worse. The bread doesn't just spike your sugar, it feeds the cycle. The glycemic index of white bread sits between 71 and 75. For context, pure glucose is 100. You are essentially eating a food that behaves metabolically like 75% pure sugar every morning with every sandwich. And the worst part? The food label doesn't tell you any of this. It shows grams of carbohydrates. It doesn't tell you the speed of absorption. The second food is something almost every American over 60 has in their refrigerator or pantry right now. Processed meats, bacon, sausage, hot dogs, deli meats, smoked ham, any meat that has been preserved, cured, smoked, or packaged with additives to extend its shelf life. In 2024, The Lancet, one of the most respected medical journals in the world, published the results of what may be the largest dietary study ever conducted on diabetes risk. Researchers analyzed data from nearly 2 million adults across 31 cohorts in 20 countries. Their finding on processed meat was direct. Of all the types of meat studied, including unprocessed red meat and poultry, processed meat was the strongest predictor of incident type 2 diabetes. Not occasionally, not marginally, consistently, across 20 countries, nearly 2 million people. Why? Processed meats contain nitrites used in curing. They contain sodium at levels that chronically elevate inflammation. And they contain saturated fats that deposit directly in the muscle tissue, which impairs the GLUT4 transporters. Those are the molecular gates that allow glucose to enter muscle cells when insulin arrives. When those gates are clogged with intramuscular fat, insulin shows up with the key and the door is still stuck. The glucose stays in the bloodstream. I had a patient, 63 years old, retired firefighter, took his metformin faithfully every morning, who couldn't get his fasting glucose below 140 no matter what we tried. We went through his diet carefully. Breakfast every morning, 2 strips of bacon, 2 eggs, toast. He'd cut the toast. He thought the bacon was fine because there were no carbs. What the research shows is that the bacon was doing damage through a completely different pathway than the bread. It took 3 months of removing the processed meat before his morning numbers started to move. Eggs, no problem. Bacon, chronic metabolic insult. The third food on this list is one that has been marketed relentlessly to your generation as heart-healthy and natural. Fruit juice, orange juice, apple juice, cranberry cocktail. Any juice, even if the label says 100% natural, no sugar added. The problem is not the fruit. The problem is what happens when you remove the fiber. When you eat a whole orange, the fiber in the flesh slows the absorption of the natural sugars dramatically. Your blood glucose rises gradually. Your pancreas has time to respond. The spike is modest. When you drink orange juice, you've removed all of that protective fiber. You've concentrated the sugar from 4 or 5 oranges into 8 ounces of liquid. And liquid sugar reaches your bloodstream in minutes, not the 30 to 45 minutes it would take from whole fruit. The speed of that spike is itself damaging. Rapid, high-amplitude blood sugar spikes cause oxidative stress in the walls of your blood vessels. This is the mechanism behind diabetic neuropathy, diabetic retinopathy, kidney damage. The speed of the spike matters as much as the height. There's a widely shared idea that juice is a healthier option than soda. For a person without metabolic issues, the difference may be marginal. For someone with type 2 diabetes or insulin resistance, both are products that deliver glucose faster than your body can handle it. A large glass of orange juice at breakfast, something millions of people with diabetes drink every morning because it seems natural and healthy, delivers roughly 26 grams of sugar, almost no fiber, and a glycemic spike that your already compromised pancreas has to fight for the next 2 to 3 hours. Here's the pattern interrupt worth pausing on. If your doctor told you to watch your sugar but didn't mention juice, they weren't wrong. They just didn't have time to go through every item in your refrigerator. That's not the physician's failure. That's the failure of a 15-minute appointment to address a 20-year chronic disease, which is why you're here. The fourth food is one most people my age remember their parents using in the kitchen every day. Margarine, shortening, any product made with partially hydrogenated vegetable oils, but also the foods that were manufactured with these fats for decades: packaged crackers, store-bought cookies, certain breads and pastries, fast food fried in industrial oils, microwave popcorn, many frozen meals. Trans fatty acids, the artificial fats created by partial hydrogenation, have what researchers call a unique cardiometabolic imprint. The World Health Organization has explicitly stated that trans fats worsen insulin resistance, particularly among individuals already predisposed, and the document uses that exact language: predisposed individuals with risk factors, including raised blood glucose and overweight. That is a clinical description of almost every person watching this video. The FDA revoked the generally recognized as safe status for industrial trans fats in 2020 and officially banned them from the American food supply. That is not a natural food safety progression. That's the FDA acknowledging that a substance that had been in the American diet for 50 years was actively harming people. It took decades of evidence and enormous public health pressure to get that decision made. Here is the part that matters for you today. The ban covers new production, but it does not mean these fats have disappeared. Products manufactured before the cutoff are still in circulation. Imported foods have different regulations, and the labeling rules allow a product to claim 0 grams trans fat per serving if the amount falls below half a gram, which means if you eat 2 servings, you've consumed nearly a gram of a substance the FDA classified as unsafe. For someone with type 2 diabetes, these residual amounts accumulate and continue to interfere with insulin receptor signaling at the cell membrane. The fifth food category is where I lose the most people in my practice, because this one is dressed up as healthy: sugary breakfast cereals and processed granola. Walk through any supermarket cereal aisle and count the boxes with words like wholesome, hearty, natural, heart-healthy, or made with whole grains. Then look at the sugar content. Many of these products contain 15 to 20 grams of added sugar per serving. Their glycemic index sits above 70, the same range as white bread, and yet they carry health claims because they've added a small percentage of oat flour or they've reduced the fat content. The processing that makes these cereals shelf-stable for 18 months destroys the structural fiber that would otherwise slow your glucose response. There's a specific phenomenon called the dawn phenomenon that I need to explain here, because it's directly relevant to what you eat for breakfast. Between 4 and 8 in the morning, your body releases a wave of counter-regulatory hormones: cortisol, glucagon, growth hormone, and adrenaline. These hormones tell your liver to manufacture glucose and release it into your bloodstream. The body does this to prepare you for the demands of waking up. In a person without diabetes, the pancreas responds quickly and clears that glucose. In a person with type 2 diabetes, the pancreatic response is slower and weaker. You wake up with your blood sugar already elevated from that overnight liver activity. Then you pour a bowl of cornflakes or oat clusters with dried fruit and pour milk over it and eat it with a glass of juice. And you have just stacked a high glycemic meal on top of an already elevated fasting glucose. Your blood sugar at 10 in the morning is going to be a disaster. And you've spent the morning wondering why you feel foggy, tired, and hungry again within 2 hours. The better breakfast isn't complicated. Eggs, unsweetened Greek yogurt with a handful of berries, a bowl of steel-cut oats, not instant oats, with no added sweetener. These have glycemic indices in the 50 to 55 range, the same morning hormones, the same fasting glucose, but a completely different trajectory for the next 4 hours. Now here's where I have to give you what I call the forbidden truth, the one the guidelines haven't caught up with. Your muscle tissue doesn't just passively receive glucose when insulin tells it to. When muscle fibers contract, when they physically move, they can absorb glucose through a completely insulin-independent pathway. They bypass the carotid lock entirely. This is why a 10-minute walk after a meal can reduce your postprandial blood sugar spike by a measurable clinical amount. Not because of calories burned. The math on calories is irrelevant here. Because the physical contraction of your leg muscles opens a molecular backdoor that doesn't require insulin. This mechanism, involving GLUT4 transporters migrating to the cell surface during muscle contraction, has been documented in exercise physiology research for 30 years. And yet the number of physicians who tell their type 2 diabetic patients to take a 10-minute walk immediately after eating is astonishingly small. That's a free intervention, no prescription, no side effects. And for seniors with limited mobility, even a gentle seated leg movement protocol activates this mechanism to a meaningful degree. The sixth food on this list requires a careful conversation because the science is nuanced and I want to be accurate with you. Alcohol. Specifically, alcohol consumed in excess, or consumed without food, or consumed while taking insulin or sulfonylurea medications. A review published in the National Institutes of Health Library analyzed the clinical consequences of alcohol in diabetic patients and found something that most people, including most patients on medication, are unaware of. When you drink alcohol, your liver prioritizes metabolizing the alcohol above all other functions. One of those other functions is gluconeogenesis, producing glucose from stored compounds to maintain stable blood sugar. While the liver is busy with the alcohol, it stops producing that backup glucose. If you are on insulin or a medication like glipizide or glimepiride that stimulates your pancreas to produce insulin, regardless of your blood sugar level, you can experience a rapid, severe, potentially dangerous drop in blood glucose. The alcohol may mask the early symptoms of that hypoglycemia, the shakiness, the sweating, the confusion, because those symptoms resemble being slightly intoxicated. This is not a rare complication. This is a documented clinical interaction that every diabetic patient on insulin or sulfonylureas should understand before they have their next drink. The separate long-term issue is this. Habitual drinking, defined in the research as 3 to 4 drinks per day, is consistently associated with higher A1C in diabetic patients. Not just higher, significantly higher. The liver cannot manage both chronic alcohol metabolism and stable glucose production simultaneously. If your morning glucose has been stubbornly elevated and you have more than one drink most evenings, the alcohol is a significant contributor that your medication cannot compensate for. One glass of dry wine with a meal is a different situation. The science does not condemn moderate drinking in diabetics across the board. But if you are drinking in the evening without food, or if you're on insulin, or if your A1C is above 8, this is a conversation worth having with your doctor before your next social occasion. The seventh food is the category that ties all of this together, and it may be the single most important shift you can make for long-term glucose control. Ultra-processed foods, packaged snacks, fast food, frozen dinners, microwavable meals, any product that has been engineered in a factory to be hyperpalatable, shelf-stable, and calorie-dense using ingredients that would not be found in a home kitchen. A meta-analysis published in 2024 and 2025 pooled data from multiple large cohort studies covering over 700,000 participants and more than 38,000 cases of type 2 diabetes. The researchers found that the highest consumers of ultra-processed foods had a 48% higher relative risk of developing type 2 diabetes compared to the lowest consumers. 48%. That's not a small statistical nudge. That's a near doubling of risk across hundreds of thousands of people. The mechanism is not simply the sugar content, though that's part of it. Ultra-processed foods contain industrial emulsifiers that disrupt the gut microbiome. They contain artificial food dyes and flavor enhancers that trigger chronic low-grade inflammation. They are engineered to be eaten fast and eaten in large quantities because their fiber has been removed and their texture has been engineered to bypass satiety signals. You can eat 500 calories of a processed snack and still feel hungry 30 minutes later. You cannot do that with 500 calories of actual food that contains fiber, protein, and water. For a senior with type 2 diabetes, the ultra-processed food problem is compounded by convenience. Many people over 65 are cooking less, for reasons of energy, mobility, living alone, or simply habit. The packaged food industry has spent billions ensuring that its products are the path of least resistance in every American kitchen. And for the metabolic health of a person with diabetes, that convenience carries a biological cost that shows up on your lab report every 3 months. Enough about the mechanism. Here's what to do. The first change, and make this change this week before anything else, is to eliminate liquid sugar entirely. Every sugary drink, every juice, every soda, every sports drink, replace them with water, sparkling water, or unsweetened tea or coffee. This single change, done consistently, produces more rapid improvement in postprandial blood sugar than almost any other dietary intervention. Your cells are not given the opportunity to be overwhelmed. The mechanisms we've discussed don't get triggered, and you don't have to cook anything or buy anything special. Water is available in your home right now. If you take insulin or a sulfonylurea medication, I want you to monitor your glucose more carefully during the first 2 weeks of making these changes. Reducing your carbohydrate and sugar intake while on medications that lower blood sugar regardless of what you eat can occasionally produce blood sugar readings that are lower than expected. This is not dangerous when managed, but it is something to watch. Tell your doctor you're making dietary changes. Show them this list. Ask them to review your current dosing in the context of a lower glycemic diet. That is a completely appropriate conversation, and any physician should welcome it. The second change is to take a 10-minute walk within 30 minutes after your largest meal of the day. Not a power walk, not exercise in the formal sense, just movement. Around the block, around your living room if mobility is limited. The contraction of your leg and core muscles during that walk activates the insulin-independent glucose uptake pathway I described earlier. Researchers have measured blood glucose continuously in older adults before and after meals, and found that a short walk after eating blunts the peak glucose spike. This is free, it has no drug interactions, and it compounds over time into meaningful improvements in insulin sensitivity that show up in your A1C over 3 months. The third change is to audit your breakfast. If you are currently eating anything that comes in a box with a serving size listed in cups, read the sugar content. If it exceeds 8 grams per serving, it is contributing to your morning glucose problem. Replace it with 2 eggs, prepared any way you like, or a serving of plain full-fat Greek yogurt with a small handful of blueberries. These breakfast choices have dramatically lower glycemic impact. They contain protein that slows digestion, and they do not stack additional glucose load on top of the dawn phenomenon. The fourth change takes more time but produces the deepest results. Begin reading food labels for one specific piece of information. Added sugars, not total carbohydrates, not calories. Added sugars are the sugars that manufacturers put into products that would not naturally contain them. They appear under dozens of different names on ingredient lists: high fructose corn syrup, dextrose, maltose, cane juice, fruit juice concentrate. Your goal is to reduce your daily intake of added sugars to below 25 grams, which is the upper limit the American Heart Association recommends for women, or below 36 for men. Most Americans with type 2 diabetes are consuming 2 to 3 times that amount without knowing it, not from candy or soda, but from salad dressings, breads, yogurts, and condiments. If you are on metformin, there is one additional caution I want to mention. Metformin works in part by reducing the liver's overnight glucose production, directly addressing the dawn phenomenon we discussed. If you significantly restrict carbohydrates, are older, or have any kidney issues, your doctor should monitor your kidney function regularly while you're on metformin. Lactic acidosis is a rare but serious complication that becomes more relevant when kidney function is reduced. This is not a reason to avoid dietary changes. It is a reason to make those changes with your doctor informed and involved. Here's what I need you to hear for the last few minutes of this video. For 40 years, type 2 diabetes was described to patients as a progressive, irreversible disease. More medication over time, higher doses, eventually insulin injections, complications that couldn't be stopped, only slowed. That was the medical consensus. And it was built on the assumption that what drives diabetes is an unfixable defect, a pancreas that simply can't do the job anymore. Then in 2018, a study called the Direct Trial was published in The Lancet. Researchers led by Professor Roy Taylor at Newcastle University enrolled 298 adults with type 2 diabetes. The average age of participants was between 55 and 72. These were not young people with newly diagnosed prediabetes. These were seniors, your peers, who had been living with type 2 diabetes for up to 6 years. The intervention was a structured dietary change program. No new medication, no surgery. After 12 months, 46% of participants achieved complete diabetes remission. Their A1C dropped below 6.5 without medication. And in the 5-year follow-up data, a meaningful percentage maintained that remission. What the direct trial proved is that the biology driving type 2 diabetes in most patients is not irreversibly broken. It responds to the right inputs. The pancreas that appears to be failing is often a pancreas that has been exhausted by decades of the wrong signals. Remove the wrong signals, the refined grains, the processed meats, the liquid sugar, the ultra-processed products, and give the system a chance to recover. The results in peer-reviewed science in The Lancet in nearly 300 seniors were not trivial. They were transformational for nearly half the participants. Your doctor may not have mentioned the direct trial. That is not because they don't care. It's because implementing a trial-level dietary intervention protocol in a standard clinical practice is extraordinarily difficult with existing resources. But you now know the trial exists. You know what it showed. And you know that the 7 categories we discussed today are the dietary inputs most directly associated with the mechanisms that drove the wrong direction for those patients before the trial. And that drove the right direction when removed. Take one action from this video today. If you can only do one thing, eliminate the liquid sugar. Every juice, every soda, every sweetened beverage. Start there. Add the 10-minute post-meal walk this week. Audit the breakfast next week. Bring this list of 7 foods to your next appointment and ask your doctor directly. Can we talk about the dietary contributors to my fasting glucose? Any physician worth their credentials will have that conversation with you. Tell me in the comments, what's the one thing your doctor has never explained about your blood sugar? I read every comment. And if this video reached you, share it with one person in your life who has been told their diabetes will only get worse and has accepted that as the inevitable truth, because the science says otherwise. This is Dr. Michael Reed. Know your numbers. Own your health.